So welcome to Pulp Nonfiction. This is another installment of our series where we're addressing issues with COVID-19. And with me today is Jonathan Reinarz, a great Richmond High School grad, a classmate. We went to school together and we kind of went our different ways after high school. And you're a medical historian living in Birmingham,
Shared
England.
that medical avenue. We followed that one.
Yes, yeah. No, yeah, we both kind of had a medical inkling. When I have a bad day, someone loses a tooth, and I guess when you have a bad day, someone's got to read another chapter.
It's exactly. Learn from the past.
That's right. Yeah, if we don't know the past, we're bound to repeat the
So
mistakes.
they say. So they say.
Yeah. Yes. Well, what I'll do is, this is your platform to give a little bit more background upon where you're coming from, and then speak in regards to previous pandemics and what we can learn and how perhaps they relate to what we're going through at the moment.
Yeah. Well, thanks for asking me to talk to you about this, Joel. This is
Mhm.
a rare occasion that the work of a medical historian seems to really have relevance in the modern world. So I think the less familiar we are with something like a medical challenge, like an epidemic,
Mhm.
people are bound to look at anywhere. And it seems that in the last couple of decades, in any case, people have been asking medical historians like myself, in the hopes, of maybe uncovering a clue of what's to come or a hint of how we might deal with some of the challenges of an epidemic that, we'll dip into that toolbook of the past. Epidemics, of course, have been studied by medical historians for decades. I mean, it's one of the staples of medical history, and the first medical historians were doctors, and many of them had experienced epidemics, but they primarily offered sweeping surveys. And if you pick up an early history of an epidemic, you'll learn everything from the first person who identified a disease to the different names that were used to talk about the same disease. But it wasn't until about the 1960s that a very different type of history was written. And I think that's the one that people look to now to maybe get a hint of what we're dealing with. Because in the 60s, people started to write, I think, more social history of medicine. People would write about the political, economic, and social context of an epidemic. They started focusing on particular epidemics, whether it's plague in the early modern or medieval period, or cholera in the 19th century, tuberculosis, and they would focus in on particular regions so that you could see how particular cultural context impacted on the way people experienced an epidemic. So, and more recently, people have written the same sort of histories about AIDS and SARS, and of course, those have some very relevant lessons to what we're going through right now. But it's interesting that when you deal with something like COVID-19, and we're talking about a vaccine being sort of 18 months in the future, suddenly we're almost even further in the past. So I've noticed that a lot of articles are coming out and people are talking about Daniel Defoe's Journal of the Plague Year. So 1722, and some people regard it as history. It's basically a novel. It's probably based on some oral history, but people are learning something about what Defoe and Samuel Pepys in 1665 went through in London when plague again was decimating the population, imposing restrictions on movement, causing people to implement social distancing, rationing to a certain extent was implemented, but also doctors, medical practitioners left the city and left people in a sense to fend for themselves. So again, what can we learn from this? Well, probably a lot of things. How did people cope? They coped quite well at that time. Maybe there are a few lessons across the board.
Mhm. Yes, and before we delve further into history, maybe you could speak a little bit to right now what you're going through in the UK. You guys are a little bit further down the road than we are here in Canada. Uh,
Yes, well,
yeah,
only just over a month ago, all the
yeah,
talk was about Brexit, and suddenly
yes,
nobody's really talking about that. Again, you're from the 1970. I was celebrating my 50th birthday in the near the end of February. Everything
yes,
seemed all right. I'm quite pleased that I had that party because it might be the last time we all get together
yes.
like that. But I think really, so the end of February, people were already starting to detect something on the horizon. There was a lot of talk about Italy, who'd been to Italy. There were, of course, people planning ski holidays to Italy, very popular for people to travel to Austria, Italy, Switzerland, France from the UK during the winter. And by the 2nd of March, we started to hear about a government action plan. Some very interesting developments as well. My children, of course, they're born in the UK. They're playing UK sports, but also North American sports. My son plays basketball. And the very first sport to end was basketball. It seems that the coaches here were looking to the NBA rather than the political leaders here. They called off the basketball season the moment that the NBA decided on the 11th of March. So my son was disappointed before anyone. And then football, of course, 2 days later, they decided to call the season there. Swimming was
That's when
seen
you
as
knew it
something.
was serious, when they touched the football.
Exactly. When it hits something like, when it's something at the heart of British culture, when they stop letting people go to the pub, the pub closures on the 21st of March, huge development. But,
Yes.
I noticed that something was happening. This was about to happen just before then. The university where I worked, the University of Birmingham, was starting to talk about shutting down. It ended up being one of the last to shut down. We were actually planning to teach on the 21st of March, but teaching ended on the 20th of March. A couple of days before that, there were already queues forming at a lot of the main grocery stores. And then, of course, the schools closed on the 20th of March. Open, though, to children of those who are involved in essential services. That, of course, includes the NHS, the 5th largest employer in the world. So that's a lot of people working for them. But also the police, 200,000 people working for the police, the fire service, another, 40,000 people. The big employers like Tesco, all of those suddenly branded essential services. So there's a lot of kids who are still going to school. But if your children aren't, or the children of people who aren't working in those sectors, of course, stopped going to school. The toilet rolls were all sold out for about 3 days. But again, I think after a couple of days of long queues at the shops and not much social distancing, the supply chain seems to have improved. By the 24th, Boris Johnson, of course, famously announced a lockdown. And that's when you saw, it was announced on the 23rd. It took effect on the 24th, but that evening, a lot of people going to the pubs. Again, once those pubs shut down, there were a lot of people still going to beaches and parks, and then gradually those beaches were shut down. And now parks, of course, are still open. People are allowed to go out for one sort of walk or run or cycle a day. That's not being policed as carefully as people maybe having barbecues in their back garden and inviting friends over. A couple of people have had those sorts of parties shut down. There's been a house party not too far from here the other day, which had to be shut down by the police. But in general, I think people are taking a very sort of relaxed approach to shutting these things down. And I think we're now sort of 4 or 5 days into this lockdown, and it seems people are coping. A lot of shops are still open, and of course it turned into more like market stalls, so that instead of walking into your bakery, you're met at the door by somebody who's got goods on a table. Everything, of course, is contactless. There's very little money being exchanged. I think there's no run on the banks here. People are happy to just pay contactless. And at the 26th of March, so yesterday, we started what the Germans had already started at about 9 o'clock in the evening. I think the Germans all applaud their health service. We do it at 8 o'clock. When you opened up the window, you could hear everybody applauding in the streets. And this is, of course, something very different, something very new. I think the British, very reserved. We're a little skeptical of it. But if you look at social media, people seem to have really been touched by this. And after the first few reports of health service workers not being able to buy groceries after their shifts in the evening, people feel like they had to show them a lot of appreciation. And of course, they've appreciated that as well. So that's basically where we're at now. A week is down. Things are still ticking over. But, the Excel Center in London, in East London, 4,000 bed hospital that has just been opened up next to the East London airport. They had military planes flying in there, practicing landings. That's what we're expecting in the next 2 weeks, really, that we haven't peaked, and people expect that that's going to be the next couple of weeks.
All right. And that 40,000 bed, is that just
The
fortunate
new
timing, or
Nightingale
was that
Hospital.
that was opening up anyway?
No, so this is like you saw in places like Wuhan, where everybody was impressed how quickly they were able to open
Also,
up a
was an
hospital in
emergency
something like 10
response.
days. This is an emergency response. This is like the Army Field Hospital that we saw in the past, where it's not going to be a hospital as we know it, but it does the trick. There'll be a lot of beds, a lot of ventilators. As for the serious cases, essentially, I think it didn't hit people until the people who are laying the electrics in there, the workers went in and, of course, immediately filmed the space, put it up on social media. And when you see the scale of it, it's a huge, huge
Hmm.
space. So again, 2 huge wards of 2,000 beds each. So that's a lot of beds in East London. And I guess that's where they expect, it's essentially our epicenter.
Hmm. Wow. Yeah, no, that's very interesting indeed.
Mm-hmm.
I didn't know about that. Now let's go back to the historical aspects of it now, and I believe Spanish flu, you think, is perhaps a good starting point for parallels to what we're going through today.
Yeah, I think so, because it's the Spanish flu, and in terms of all the
Those
sequencing
damn
work that
Spaniards.
yes, I know. Unfortunately, yes, we can talk about that in a minute. But yes, for
Yeah.
various reasons, the naming that the Spanish flu never really helped the Spanish. It is, of course, a misnomer.
Mhm.
A neutral country during the war. Again, censorship wasn't imposed. They weren't too worried about keeping up morale of the troops. So normal reporting, as would have happened before then as well, people were regularly reporting notifiable diseases, and in this case, it was influenza. And of course, I think it's an unfortunate comparison as well, because we are talking about one of the deadliest epidemics in history. So if people were already comparing it to, say, SARS, where a much smaller final death toll resulted, they are comparing it to one of the most deadly epidemics in history, with uh, approximately 50 million deaths attributed to it, but 250,000 of those in the UK. But of course, it was very different. There are similarities, but we have to remember that there are differences. That was an outbreak that occurred at the end of the First World War. So a lot of movement of troops around the globe, which made it a global pandemic. But of course, we live in a world that operates like that. We're just not sending troops around the world. We're at least sending, everybody for business, for holidays. And the airlines, of course, are taking that huge hit, because one of the first things was to shut down that movement. So again, they did close public spaces during that epidemic, and there's a very well-known epidemic case that's being put out there from that particular epidemic,
Mhm.
comparing. I think there was a lot of discussion around this because of the St. Patrick's Day parades. So at the time, parades, very big social events in communities, and Philadelphia had decided to go ahead with one, and St. Louis had decided to cancel theirs. And people who've gone back and done the sort of disease tracking now are seeing a spike in all those cities where they continued organizing these sorts of events. So that kind of history was rolled out to teach people the lesson of social distancing, quarantine, the importance of ending these sorts of events. Again, the numbers, we don't know exactly how many people were sick with this disease, because there were so many other things people were suffering from at that time. And again, because of the war, the condition of the population, while I'd say the numbers of extremely vulnerable people were much larger than today. But I think the other thing that's interesting is that it did occur at the end of a world war. So those war metaphors, those military metaphors that are associated with that outbreak, are rolled out continually in epidemics. And you're seeing that we are fighting a virus. And some people say that's acceptable rhetoric, and others say that it doesn't do well to think of disease in those terms. At least some people have argued this about cancer, for example. But what is the impact of talking about a fight against disease? Does it facilitate, let's say, more extreme measures. If you think about the way we've tackled malaria around the world, when we use those military metaphors, sometimes it justifies people coming into communities and spraying DDT and taking that kind of measure, as opposed to educating people in a marketplace, giving them mosquito nets and the advice that they need. There's two very different ways of tackling diseases. And I think the military metaphor is one that drives those extreme sort of responses. And actually, there's other military words being bandied about right now. So rations, some people are, that's something that comes right out of the war. You know, are we going to have to ration some things? Well, it seems that the PPE has to be rationed, because started wearing masks and we were told very quickly, you know, they need them in hospital. And even my children's schools are donating the gloves from the science class to the local hospital, because some people are wearing these from 8 o'clock in the morning to whenever their shift ends. Again, those sorts of gear changes need to be made. So the other war word that's being bandied about, the other R word, reparations. Again, the right wing coming out and saying, when this is all over, we have to make the Chinese pay, which is, of course, what people said at the end of wars. And it seems that this is something that in the future, some people want to think about in terms of epidemics. You know, who's going to pay? Are we going to be tracing it back to the patient zeros? Or, you know, are we going to be a little bit more open-minded to say that we're all victims of this, as opposed to who's guilty? So there are some interesting comparisons with the Spanish flu, and then you can see that there are some big differences as well.
Yeah.
Can we talk a little bit about more about naming?
Yeah.
Now that we've touched on it, because I think as a historian, I think there's some really interesting lessons about naming epidemics. So Spanish flu we've covered. Most diseases, you know, they get the eponymous name, that lucky person who discovered it. So they're forever associated. Hopefully, if you discover a disease, it's one that isn't so horrible. So you notice that a lot of other sort of epidemics were not necessarily named after those people who discovered the causative agent, for example. But syphilis is one of the obvious ones. That syphilis was, luz venera, or venereal disease. It was called the Italian disease or the French disease, depending on which side of the border you were, or whose troops you were most resenting being in your country. But that's a venereal disease. They've always had that sort of stigma attached to them. But if you look at things like polio, so a few of my students have worked on polio, and I've just finished reading some of the new work on epidemics, which is on polio in Eastern Europe and polio in this country and polio in North America, named originally after the individuals who identified the causative organism, a German, Jacob Heine, and a Swede, Carl Medin. So it was known as Heine-Medin disease. It was also, because of the symptoms, it was referred to as infantile paralysis. But that was a little bit of a misnomer, because once it disappeared for a while, all these epidemics were turning into childhood diseases at one point in the 20th century. We didn't see it for a while. And when it came back after the Second World War, a lot of young adults who thought they wouldn't have to worry about this were hit down by this disease. So you can see within COVID, a lot of people think it's only the elderly. And then you start hearing cases of 18-year-olds. I think that was one in the UK recently. It was also known as autumn disease. Polio was known as autumn disease because it sort of struck at the end of summer. Now, a lot of talk has been about, is this another seasonal virus? It is a global virus. It's in Australia. It's summer there. Guangzhou was 20 degrees when it was hitting Guangzhou. It was 11 degrees or 10 degrees in Wuhan when it was there. It was a little bit colder in Italy. We've seen it pretty much traveling in all sorts of temperatures. So I think these names, I think, heighten expectations to, you know, how long it's going to be around. But I don't think we know just yet how long this one's going to be around. But the epidemiologists are sort of tracking it. They'll be telling us whether it is dispersing a little bit with the warmer weather. And then, of course, more recently, you know, you can find all those cases from the past. People maybe forgot that H1N1 was originally going to be called the Mexican virus, because it was traced to Veracruz in Mexico. It was also going to be called S1, swine infection, again, or influenza. It made a lot of people stay away from pork. You couldn't get it from eating pork. So it has this economic impact that was unintended because of naming it. And of course, this one's already, Trump's jumped right into it by, you could see his script the other day where he had drawn a line straight through COVID and called it the Chinese virus. So again, it's becoming a political tool. Wuhan, the World Health Organization has steered away from this. They even tried to refrain from calling it a pandemic because some people felt that it had caused too much of a scare last time around in 2009. So I think you can see how words, language are so important. I think if anything is new to this epidemic, social distancing. Spoke to some retired virologists who feel that this is a word that they don't understand. The public might misunderstand. You could see that people have to, in McDonald's in New York, they were making markers on the ground showing people where to stand. So social distancing isn't immediately understood. So this is going to be, I think, our addition to that language of epidemics from Wuhan, Chinese flu. I think they even called it Hong flu in one of the press conferences run by the White House. So lots of that kind of derogatory language coming out, but new language like social distancing, all sorts of things that the next generation is probably going to be much more familiar with.
Yeah, I know in the past, a lot of fear, and that maybe stimulated the naming of the virus or the pandemics, because then it could be somebody else. It's not us, and that's perhaps what is stimulating some of the regional, the motivation to give it a regional name is so that it's like it makes yourself look like it's not us, and they impose it upon us and gives a wrong spin on it.
Yeah, there's one of the important reasons to have these sorts of organizations like the World Health Organization, formed in 1948, and you've got another neutral body which can steer away from that. That's their job. Is when they give it a name. We're used to things like H5N1, and people sometimes find that a little confusing. But at least it gets away from if there's a name, of course, associated with the new form of naming. I think H5N1 was the formal lengthy name had Nakhon Pathom incorporated into it, a place in Thailand where the virus was officially isolated. So that's, I think, the only sort of place that belongs in the current naming of a virus. But the way that some people are still trying to stick to that old method of associating it with a particular place, maybe we just need a bit more teaching in science communication and tell people what these things like H5N1 stand for, so that they can at least get a sense of what the scientists are doing to sequence, to understand these, whether they are a new form, an old form, that sort of thing.
Well, the provincial health minister here in BC has proposed the name PDC virus because I'm joking, of course, because I think it came from the Pacific Dental Conference here, and the dentists here in British Columbia are the worst people in the world. So
still, it's probably unfortunate that you had to go through that, but it teaches an important lesson, because it's the exact same thing that all of the first aid sufferers went through. There were those 4 categories that everybody remembered. It was homosexuals, Haitians, hemophiliacs, and heroin users. And of course, it affected so many more people.
Very rough years.
Right? Exactly. So, I mean, we didn't learn until very recently, and people will continue to make the same mistakes.
Yes. I think maybe going forward, the city where they discover the vaccine, maybe give it the name. So the name is actually associated with a positive aspect as opposed to a negative aspect of it.
Yeah, exactly. But then you'll see everybody will want that. There'll be rivalries. It's like the Nobel Prize,
Oh, of course.
How many people want to share this in the end?
Yeah. But, whatever city, and that's a badge of honor. But the way commercialization is going is maybe it'll be a drug company, and they'll say this is.
Yeah. And if they have to share it, let's say between 3 labs, it would be good to see a Thai lab, a Chinese lab and say a British lab or a Canadian lab share that honor. I mean, that shows how global epidemic research, not just the epidemics, has become.
Yeah, no, absolutely. Yeah. So maybe take the negative connotation and put a positive connotation on the name,
Oh,
because
yeah.
the generic names, I know that they're soft and not offensive, but they're also perhaps a bit bland. And as you know, in history, when you go back, um, it's so colorful and rich. You almost don't want
Yeah, yeah.
today's history to be bland. I mean, the way they described, I'm sure in some of the historical texts that you read, I mean, they're just so colorful with their language.
They are, but I still think that's no excuse to keep someone like Trump just because he makes our lives a little bit more colorful. That's, I think, some of the things he says should be edited down. I'm starting to miss the dry bureaucratic press conferences run by politicians. But anyway, that's another
Oh,
story.
no argument with you on that one. So, historical. What are some of the big missteps that you would have seen, like from a historical perspective, that perhaps you might are
Yeah.
worth us looking at and saying, "Oh, let's not
Well,
repeat
other
that."
than the one we just other than the one we just spoke about, the terms of
Yeah,
naming and
yeah,
associating an epidemic or a disease with a particular group, absolutely.
yeah,
Um, in terms of what we're seeing, the economic impact, I think that's a big misstep because I
mhm,
think people are going to be talking about how quickly governments responded.
mhm,
Now, England was very slow, and England's always been very slow in responding to epidemics because it is that sort of home of the free market, laissez-faire. Adam Smith from Scotland, his ideas, the invisible hand is
yeah,
the best hand to have in regulating the economy. And lots of other countries in continental Europe in the 18th and 19th centuries were not taking that approach. But what you ended up getting was, even though the science at that time, which is different from ours, at least people agreed on what caused these epidemics, something like bad air, or there was some idea of contagion, but it traveled not in germs, but in people themselves. Um, though the economic ideas could lead to a very slow response. So when I look at some of the epidemics from the 19th century, cholera, for example, a lot of these epidemics could have been shut down immediately, but people didn't want to disrupt the economy. This is the 19th century, the booming period of the Industrial Revolution. And had they done something like that just when the English poor are in full employment, learning new trades, going into factories, England has its empire, and they're basically shipping those products throughout the empire, but throughout the world. A lot of doctors, these professionals, were heavily invested in that economic growth. So not surprisingly, a lot of the British doctors preferred to take that laissez-faire approach to epidemics as well. So they would maybe isolate one or two cases, but they never implemented quarantine in the same way that, let's say, the Italians did, the cordon sanitaire that the French introduced, locking people up when a ship came into harbor for 40 days. The British were much more laid back. Sure, they would look for the visible signs of an illness the same way they would in America when people landed at Ellis Island. But if you didn't have sort of seepage from the eyes or a pox on the skin or something like that, you tended to get through. And I think that's one of the big lessons as well, that we saw it being rolled out in this case of COVID-19. The slow response, because people knew that the economic impact would be devastating. Now, everybody's going through this. It seems that in some cases, industries, countries were buying 1 or 2 days, because 1 or 2 days of continued business seemed to make all the difference. In the UK, we have Weatherspoon's pubs, 900 pubs. And the founder, chairperson of Weatherspoon's, Tim Martin, was, of course, pro-Brexit. But here again, he was saying no need to shut down the economy. So again, that many pubs and people still coming together. Of course, he was concerned about losing all that income. But so are a lot of other people. And the talk lately from Trump to get things going again by Easter, and he wants to see those churches full. I mean, these are the sorts of economic anxieties driving the way that an epidemic is dealt with, as opposed to the epidemiological sort of expertise.
Jaws comes into it.
Yes, of course. So there's
Yeah.
a new book called The Pandemic Century. I mean, if you want perfect timing, Mark Honigsbaum's book came out last year,
Mm-hmm.
and it starts with this amazing, I never heard of it before. We all know Jaws, but apparently just before the Spanish flu, there were sightings of great white sharks farther north on the east coast of America than they had been spotted before. And all these new sort of resorts up to New York State didn't want to believe that this is something they had to deal with. So just like in Jaws, when you had an anxious police chief endlessly debating with the mayor who wants to keep those beaches open because the tourists are too important to the local economy, this sort of debate is replayed within lots of communities. You know, when will it be all right to lift these restrictions and let people fly again, to run those festivals, those conferences, all of those sorts of things? People are desperate to open up their stores again. And when you look at the big chains, if they haven't shifted online, then that's what they're going to be pushing for. So I think that kind of a lesson, I think, is hugely important. So not just from the epidemics, but even from a film that everybody's seen. It did happen. It's not all fiction. It's another lesson from history. But I think also in terms of the economic impact, we know that it's going to have an impact on the economy. We don't know how long those economies are going to be shut down for. It's very interesting that although everybody has the same data, that different countries, different responses. I'm surprised at the British response. Though they were very concerned about the economic impact, they seem to have rolled out one of the most generous packages to support the economy, sort of up to 80% of people's incomes. I don't know what they're offering in Canada, but I doubt it's as generous.
Mm-hmm.
And a lot of people have been talking in public health about health inequalities for a long time, which of course feed into epidemics and those endemic diseases, especially diseases of childhood. You see them amongst particular communities. Well, they say we're all in the same boat now, but I do think there's a bit of truth in this. So along with those economic packages that are being rolled out, the British have recently put something like £3 million aside for the homeless. So again, people who are going to find it even more difficult to get through those next weeks. But I think, that budget that came out here in the UK on the 17th of March, people will be looking at that long afterwards. It was already, I think, a historic budget, but I think that the sort of money that's been earmarked to support businesses and individuals, self-employed now is the big discussion here. How will their incomes be calculated? But they're also going to be getting some support. So what Rishi Sunak, the Chancellor of the Exchequer, is currently, I think, one of the most popular people in British politics, not just by the way he's delivered the news in those daily press conferences, but what he's offered people is a little bit of good news at a very trying time. So again, not always, if you think about how you respond to an epidemic, you could make all the wrong decisions by delaying that call for lockdown. But if you also treat the economy as well as the medics are treating the population, then I think you'll see a better sort of weathering of the storm, I guess you could say.
Yes.
Maybe could I say something about health inequalities? Just reminded me of celebrity. I'd like to talk a little bit about celebrity.
You want to talk about me?
If that's all right. Well,
yes, no, absolutely. Celebrity, absolutely, yeah.
Not local celebrities. Local celebrities, yeah, sure.
Oh,
you might
be
one in Vancouver.
Kill me. I'm only local. Okay. No. Yeah, no. That's really.
You're right. I know. Yeah.
You just blew my world, but yeah. No. That's a very good point because as society now, I mean, celebrities are, up there. Yeah. So
they've been speaking out. They've been locked down in their places. They're on social media. But, today the news I woke up to was Boris Johnson has tested positive for COVID-19.
Yes.
So again, all those numbers we were hearing.
I'm playing Sophie. They probably went for dinner.
Yeah. Well, we have 100,000 people who are positive with COVID virus, but we have a few celebrities, and those are the ones that will make the headlines. Prince Charles.
Mm-hmm.
This makes a huge difference. You think back to polio. those early outbreaks in the 20th century, an American president, FDR, in a wheelchair because he had polio in his late childhood.
Mm-hmm.
But we saw Tom Hanks, his son, updating the population. And then, of course, when these celebrities come online, they're usually sending a message about social distancing. So when you're trying to communicate these new ideas, getting people to take it seriously, sometimes they want to see one of their celebrities telling them what's important, not a politician again. So, of course, celebrities have taken a lot of flack in the past. As they have this time, they can usually jet off somewhere, or if they're self-isolating, they're usually self-isolating in a palace somewhere. Their kitchens are usually as big as most people's apartments, and they've been criticized for that in the same way that the wealthy disappeared during the plague in the past. And
Mm-hmm.
doctors were included in there, the top doctors in London disappearing the moment that plague broke out in 1665 in London.
Well, exactly.
But
And China was able to get, I mean, they said to 7,000 physicians, you're going to Wuhan.
yes, and again,
And just so you know, you are going.
that's where the politics comes into it. Yeah,
Yeah.
in the past, that's the continental method, I would say, the continental European method, where the government usually told people, this is what you're doing. And
Mm-hmm.
then the British method was a little bit, somebody will stick around, somebody will see it as an opportunity to make their reputation, to build their status, but you're not going to tell everybody to do that. But in any case, I think the celebrity victim is going to be very interesting here, not just Prince Charles and Boris Johnson, but I think there's something, it's going to say something about patient confidentiality. People will want updates. They will want to sort of follow when they're getting better. And of course, that getting better is part of the feel-good moment, I think, of an epidemic as well. But it also convinces people, if you're being told the whole time, we're all in this together. We heard that during recessions, we heard that, but when you're in an epidemic and you suddenly see a celebrity, attached to a ventilator, you do get the feeling that you don't get during a recession, that you're all in it together. Now, and
Yeah.
in the past, this was hugely important. So if I go back to polio again, your football, Joel, but there was an England footballer, and he also played for Birmingham City in the 1950s. I think he had something like 200 appearances and maybe 18 appearances as an England player. His name was Jeff Hall. And if you
Yes.
look him up, when Jeff Hall not only contracted polio, here was a fit, this, if you think about what they've been telling us about who gets COVID-19, but here's a fit individual, an England footballer, he got polio, and he died during the 1959 outbreak. It was what made people queue up to get vaccinated in this country. So that's another side of the celebrity victim, if you want to call it, the patient, that is hugely important. We had another, so Big Brother is on television around the world, another global phenomenon, beside a little bit of an epidemic itself. But we had a person in the Big Brother house, I think it was 2002, her name was Jane Goody, and she pushed young women to have cervical screening. And she ended up dying in 2009, but the uptake of that particular vaccine increased considerably because she became a champion for that. So I think that may be something. We're talking about a vaccine 18 months from now, but we still have people questioning vaccines. Vaccines shouldn't be rushed, of course. That's something we've learned from past epidemics, that when polio epidemics occurred and people rushed vaccines, we had things like the Qatar incident, where some 250 cases were the result of a contaminated vaccine. So I think people, and during the AIDS epidemic as well, a lot of lobbying was going on. People pushing, suspending the powers of the FDA because they wanted to see a cure sooner. And when those sorts of things have happened, we've also had further tragedies. So I think that's a real sort of lesson. And I think, when it's done properly, people like Alexander Fleming, who, of course, developed or recognized penicillin's medical potential, made it on the front cover of Time magazine, and he became a bit of a celebrity. But unfortunately, Ebola was that person or thing of the year in 2014. I'm convinced that COVID-19 will be on the front of that 2020. It will become a bit of a celebrity itself when Time magazine chooses its person of the year. But I think
And
celebrity is hugely tied into all outbreaks like this.
yes, and actually reference to AIDS. Right now, everyone's a bit united, but AIDS, there was a division, and maybe you could speak a little bit to that. In South Africa, the government was AIDS, and they had a different take on it than the rest of the world, and that was a government policy. Was it not? I mean, I don't know that much
Yeah,
about
yeah.
it, but I remember it became a real big problem with South Africa, because then the rates went skyrocketed, because they were saying, well, it's not with the HIV virus, or it's not this, it's not that, which flew in the face of what we in the West had accepted and
Yeah.
adopted.
Well, yeah, you're absolutely right. And it just goes to show you the difference that one person could make. Like someone like Jacob Zuma, who had his own ideas of what was causing AIDS to spread. A huge contrast between what Nelson Mandela, who I think had a son who died of AIDS as well. So,
Mm-hmm.
there you have the problem of the dissemination of information. And again, I think it is a difficult case to look at, because there's also an element of West knowing best. We're watching COVID's movement, and it's only just starting to hit Africa. So Egypt is reporting cases, but already a journalist has been expelled from the country because she was saying that they were downplaying the numbers. You can see that within certain regimes, the government will use this as a political tool. And again, we're suspecting that the cases will be downplayed in Russia. I think China has surprised a lot of people, because the AIDS epidemic there, people were suspecting the numbers were being downplayed. But I think China has probably also learned from its mistakes. And most people are trusting the number of cases that have been reported. And of
Yeah.
course, a country like South Korea, where they're actually testing for cases and they can track them much more effectively, and Singapore, of course, will be
Taiwan
much more.
as well, right?
Yeah,
Taiwan
sorry.
and
Yes,
Taiwan.
exactly.
Yeah, yeah.
But I think you're right. That watch that COVID-19 as it starts to go into Africa. I was supposed to be in South Africa for a conference at the end of May. I just had an email the other day. Of course, they canceled that as well. They said that they're dealing with cases already. So it might be a political story as well, and it depends on who goes helping out where as well, because when epidemics have moved around the globe, often humanitarian workers have been blamed for spreading it, as they were when cholera appeared in Haiti,
Mm-hmm.
and again in Zimbabwe, where people were suggesting, because they saw humanitarian workers treating wells, they said that they were poisoning wells. So you see that it's a game that can very easily be played. It can be misinterpreted. What people, if you don't communicate what you're doing to the population, they can suspect you're doing anything. You
Yes,
have to tell people very carefully, this is why we're treating the water, for example.
yeah. Vaccines in rural Pakistan was seen as Western poisoning of the locals.
Yeah. And
Yeah.
again, there have been lots of mistakes in Western medicine as well. So again, there are reasons why people are skeptical. If you think about some of the sort of the drug testing that's going on in Africa as well, I think it'll depend on, you're seeing the Cubans fly around the world right now, help out in Italy. You're
Mhm.
seeing the Chinese landing with medical workers and equipment in Italy. Again, that's maybe the extent of the reparations they're offering, if you want to call it that. But clearly, they want to help bring this under control. But depending on who ends up landing in a particular country, the reception might be very different.
And correct me if I'm wrong, but I believe that Africa, with its recent 20 years of medical experience, that continent is actually quite well, their medical system is quite well adapted to infectious diseases, perhaps more so than we are in
Oh, yeah,
the
absolutely.
US,
Oh,
because
well,
that's their
that's a
primary
good.
focus, is to keep those things at bay. So maybe
That's a
Africa is
very
going to
good point.
be better off than what your natural prejudice for Africa is that it might hit it hard, but
Yeah, yeah. Well, they're
they're
just
going to
they're
do.
just coming out of an Ebola
Yeah,
epidemic. If anything, they probably will tackle this very differently. I agree with you 100% there. So, see, I think that takes us nicely to the point of medical education, which is
yes.
one of the things I wanted to talk to you about, because how prepared are some of these societies or some of these countries where, if you look at the UK, they should have been more prepared. But there are people who are predicting something like this from the 60s and the 70s. So we had a big influenza epidemic in the UK in 1957. But again, infectious diseases is hardly being taught here anymore. There's a real shift away from public health that was associated with infectious diseases to public health that was associated with the new public health. People controlling their diet, not smoking, you know, all of those sorts of controlling your drinking. It's a very personal, it's a very different type of public health than we're used to, which is associated with, you know, the slums of the 19th century and cholera and all these other epidemic diseases that were becoming childhood diseases, essentially. But I think, you know, infectious diseases, it's been underfunded, there's been underinvestment. If you look at people who've been studying medicine in the UK, they're not getting much teaching in this area. They might intercalate for a year and do global health and go off to Africa, where they might work in a community where a lot of cases that they'll never see in the UK are being treated. But, you know, what does infectious diseases mean? Well, I think at the moment, there are not many empty beds, but I think the goal of infectious diseases is to keep those beds empty, and it just doesn't make sense for hospitals to invest in empty beds. So of course, surgery, much easier for hospitals to make money in those sorts of situations. At the moment, the people who are talking about COVID-19 in the UK, they're virologists, but virologists might be, you know, have some of the answers in terms of sequencing this virus, but they don't have much experience in managing the patients with them. So we're actually seeing a shortage of people who have any experience treating these sorts of diseases. So I think that says something about the sort of medical education people have had. So when they decide that because of the demand for medical care at this moment, that they're going to allow medical students to graduate early. So something like 5,000 med students will now finish early. Many more thousands of nurses as well, not having to write their final exams, but being sent out like they did in the First and Second World Wars, letting these people finish their medical education early. I think there are lots of ways to truncate that medical education because of what you said. They just haven't been learning infectious diseases. So, you know, in the 1950s, when they were dealing with flu, they were spending 2 years still dissecting corpses. Now, that is important knowledge, but 2 years of their education was spent doing that. And then they're going out and treating people with infectious diseases. So I think it's a very crowded curriculum today compared to the 1950s, but there are still a lot of things which are not as relevant in this outbreak. So to allow these students, I think the real question would be, what kind of students are we going to make? You know, are they going to be better at treating people online after this? Are they going to be better at communicating face-to-face with people? Will they understand PPE a bit better? Will they be good at treating infectious diseases? Of course. It didn't seem to make a difference when they truncated medical education during epidemics and emergencies in the past. I don't think it's going to make a difference this time.
Mm-hmm. Yeah, they're going to learn quick and on their feet. And one of the things might be interesting is they might have to, when calmness returns, recalibrate themselves, because right now you prioritize your treatment and you're perhaps very factual, and and you have new priorities. And then when things calm down, you know, they might have to recalibrate themselves. Okay, you're worried about you know, an infection on your toenail. You know, like, wait a minute, that, because right now that's not important. And then
Yeah,
all you
yeah.
have all these physicians, but okay, wait a minute, we do have to address that now, because now that is important. Whereas right now we prioritize, like, and so it'll
But
be
then
interesting for them.
I
Yeah.
agree. I agree. So there's, if you want to take that idea further in terms of, so I would say on the one hand, mild symptoms, though, will still cause a lot of anxiety because of what we're seeing. We see a lot of cases of COVID-19, which people, you know, weather very easily. And then, of course, you see the dramatic cases on social media, tours of hospitals being given at the moment, and you see some very distressing scenes there. The
Oh
other thing
yeah.
is that in terms of medical education, they're going to start having to make some important ethical decisions as well. So at some medical schools where ethics hasn't been taught, they're talking about if the public's not rationing food, but they're rationing medical services. If they only have a certain number of ventilators, they're going to have to make some very hard decisions. In fact,
Whose
coming out
mother's
of
gonna
Spain,
die, right?
exactly, and that's happened in the past as well. But
Yeah.
that's a lesson that I don't think. I mean, you can teach it in the classroom, but in terms of the vocational training that these students are getting now on wards in an emergency, I think they're gonna they're going to make decisions, and they're going to deal with them in a very different way. And I think they'll see them in a more realistic way than they might have in a classroom.
Yeah, and you touched on it before we started the recording. The mental health implications of the social isolation and everything. Because right now we're
Yeah.
dealing with the trauma of the pandemic.
Yeah.
But you know, the mental implications are put to the side. The counseling, the different things like that. Because from a dental perspective, we're dealing with people with tooth pain.
Yeah.
Sometimes a person has a little bit of pain, but a lot of concern.
Yeah. So
And
you understand, at least in the dental office, you understand the fear.
yes,
So, and I
yeah,
think that is,
yeah.
epidemics bring a lot of fear.
Yes.
But I think there's a whole other side. You're right. So that in terms of the mental health, the mental impact, or the impact on mental health, we've used this word a few times now. And of course, we're seeing quarantine rolled out. But there's some very interesting studies that I've come across recently. Isolation hospitals in the past, where we're now discovering what people did the months that they were in quarantine, whether that was on an island in the harbor in Venice, or
Mhm.
in the Caribbean, or anywhere else. But so, you know, we're starting to be told by historians that quarantine is this word that comes from, you know, Italy. It's got religious connotations. The sort of the period of Lent, you're denying yourself something. These 40 days of you know, plentiful food. Well, quarantine means a lot more than 40 days now. In some cases, it means for 18 months. You know, if you think about the vulnerable who don't have a vaccine, that's 540 days.
Yeah.
So suddenly quarantine has become something that could be very isolating. It could have a huge impact. And we're already seeing that in terms of COVID-19, a few hotspots in America. One of them centered on the Life Care Center in Kirkland, you know, this old age home
Mhm.
where, for whatever reasons, people became infected. And you have one of the sort of highest death rates in a single institution. Around the world, people are now isolating these 70 plus individuals. In some cases, people aren't going to see grandma or grandpa
Yeah.
for months. They're visiting people through windows, exactly as they did in past epidemics. When you had infectious diseases in the 19th century and they started building those isolation hospitals in the UK, lots of stories of people visiting and making a huge trek. You know, they're usually on the outsides of towns, they're far away from the cities, and they're looking through windows. They're visiting these people, but they're not talking to them. There's no touch. You think about those last days that somebody might be spending in palliative care and the families are being kept away. Of course, the medical practitioners are going to be there and they know how to deal with this, but it's not quite the same as being there with a family member. And people are being restricted in terms of hospital visiting, for example. We already knew that hospital visiting could be restricted, but we're starting to see, you know, children's hospitals, they're restricting it to one parent. And while people have always played that game and said in the past, okay, you go this week and I go next week, a lot of places are saying no, the same one person each time. We're going to keep it simple. We're not going to bring different people in. So it's going to have a huge impact. If you think about the history of medicine in the last 50, 60 years, it's only in this time that we opened up children's hospitals to more regular or open visiting. So maybe in our lifetimes, Joel, when we were ill, our families could come into hospital, but the same people who are maybe going to be spending the last year of their life in extreme isolation have already gone through loneliness and isolation in old age. And we're also children of that generation that when they went to hospital for 2 weeks or a week, they did that in isolation in their childhoods, because that's what it was like going to hospital in the 1940s. By the 1950s, psychiatrists were starting to do work on this. Separation anxiety was recognized as a condition. John Bowlby and James Robertson, you can watch their very influential video, A 2-Year-Old Goes to Hospital, which I think was made in 1952. They filmed the child and the distress that this child went through being separated from family, and how they gradually became more and more silent and withdrawn over the week or two that they spent in hospital. Well, that's a huge, huge impact on people in quarantine and isolation. We're all getting a taste of it. Of course, it's not as extreme as the elderly in care homes, but I think we're all going to be dealing with, you know, this is great seeing you after all these years, Joel, but I'm glad that all my interaction isn't like this. And luckily,
Yeah.
I am quarantined with family. But some people are going to be dealing with the very difficult periods of isolation. And I think we'll see it in extreme cases in care homes and these sorts of scenarios.
Yeah, that brings up 2 points. The Ceausescu orphans, because they had little social interaction.
Yes.
All those orphans, and it severely affected their mental health. So for the young kids, brutal impact. But then at the end of your life, that'll have a brutal impact as well. You've
Yeah.
spent your whole life being social, bringing up your family, and then the door shut, and their mental capacity with a lot of these people is not great, so they can't understand why they're being shunned.
Yes. Yeah, absolutely. If they don't understand the conditions, and I'm sure that existed in the past, but I'll tell you something. The interesting thing is, I don't have many historical examples of that
Uh-huh.
because this is maybe a nice change. If you want to see something positive in terms of, it's clearly something a lot of people are thinking about. But
Yeah.
in the Victorian period, it seems that you might have ended up in a poorhouse or a workhouse, and there was nobody visiting you there. And it doesn't seem to be written about, but there must have been a lot of old people isolated in exactly that way, whether there was an epidemic or not. I
Hmm.
think we've said a lot of things about the way we treat the elderly in the last couple of decades as the population generally starts to age. I think this kind of moment has also shown that despite the fact that people are putting the elderly into homes, they do care about them. You're seeing some very interesting experiments as well, because in Germany, a few months ago, somebody wrote an article for one of the main news magazines, Der Spiegel, and it was a partner who found it so difficult putting his wife into a care home that he decided to move into the care home as well. And now I've heard from some colleagues in Germany that that example was already known, that as soon as people knew that these care homes would be locked down for extended periods of time, a lot of people have opted to move in with their partners or in some
Ah.
cases with their parents. But that means shutting themselves off for months. So instead of being separated, they've decided that they'd rather be together, and there are people moving into some old age homes. And who knows? Maybe this is something we're going to have to be thinking about as well. So there's another interesting lesson, I guess, from the past. Very different ways. We're going to experience all sorts of changes, I think, when this is over. But some of them, we haven't quite seen, so, how we're going to be living in what will be a very different world when this all ends, when it all ends.
Well, care homes, it's very popular in Holland. They now have a mix of young university students in the same facility as the old people, because they can, feed off each other. And and
Yes,
and,
yes. And a lot
and
of old age homes being used as daycares as
yeah,
well.
yeah.
Yes.
And the shame is that's not going to happen anytime soon. And there's going to be a lot of reservation to go back that way, because I know that a lot of Canadians are looking at how the Dutch were doing it, and you're thinking, well, that's probably a good idea, especially here in Vancouver. Everything's so expensive. You have an old folks home, and you had some young university students in there. Um,
Yep.
it would be a great positive. You would solve many problems, and socially, it would be a big plus.
Yep.
We're probably gonna that's gonna be put back 5-10 years maybe now.
Yep. Yeah. Well, absolutely. And if you think about it, infectious diseases, as I said it a couple of times in
Yeah,
this discussion, usually they were associated with children.
yeah,
A lot of infectious diseases became childhood diseases. So again, this idea of putting children into old age homes sounds completely ridiculous. Again, you can see how that suddenly will set back all sorts of interesting experiments and what seemed one answer to problems of loneliness and providing that sort of human contact for the elderly. Yeah, you'll see something a little bit more like the care homes of the early 20th century, maybe, with very little contact. And for some time, I suspect, because there's always somebody predicting the next epidemic. And I think after being through something like this, which again trumps SARS, trumps these other ones we've been through, people will remember this. And though we didn't remember all the lessons from these other sort of influenza outbreaks since, I think people will remember this for a very long time.
yes. And a word of warning to you and everyone who's self-isolating: the divorce rate in Wuhan has gone through the roof because these people have been locked together.
Yeah, so it's certainly a test. Yeah, I think
Yeah.
if you weren't certain that it was the right relationship, you will know after the self-isolation ends. Absolutely. I
Yeah.
think, well, one of the nice things too is that all sorts of jokes going around in memes and little on the internet, the way that people can weather the storm by sharing this kind of humor online will probably help as well. So being locked up is one thing, but when the rest of the family is constantly coming across these little snippets of humor, something that's shared, it's amazing to see how quickly all these same videos are going around. You know, things that people were sending to each other the moment the lockdown started here.
Hmm.
You know, the next country that's going through it, the same sort of clips and videos are being shared, and something I've picked up having family around the world, in Europe, in North America. There's a lot of stuff circulating very quickly, not just viruses, but we're all looking at the same sort of stuff online. We're all getting the same news much quicker. And this, again, as much as I'd like everybody to learn from history, there's always something that makes the particular epidemic very unique. So I
Hmm.
think there's a lot of people, not just the historians, sharing their experience, but I think we're trying to get on top of something that really is unprecedented. And I know there's people who don't want to hear that word again, but I think there's lots of reasons to use it because there's so many things that we've never seen before and that we're going through for the first time.
Well, yeah, I think in living memory, this is the first time so much of the world's been locked down, and so much of the world has socialized medicine, or government medicine. Because back in the 50s and all that, not a lot of the world had medicine for everybody. A lot of the medicine was private, and we're much more connected. Can you
Yeah.
imagine, like, when we were in our 20s, social isolation? Okay, we'd have no idea what was going on
Yep.
anywhere. Yeah.
Yeah, absolutely. Um, but I also think that what you mentioned there is an important point that, everybody always talks about science as being universal. It's a virus, whether you isolate it in a lab in Thailand or you isolate it in a lab in Germany or the UK, it's still the same virus.
Yes.
Then that virus escapes into the community somehow from a market or other means, and the different stories that unfold are remarkable. And then you have the different responses from the governments. People will be talking about that, what you just touched on, socialized medicine. After this, is
Yeah.
that healthcare system that you got used to as good as you thought it was? Is this going to be the final sort of cheer for the American medical service the way it is? Is it going to shift a little bit to something that the UK has? People were worried about the NHS and what its future looked like in the UK. The applause that those healthcare workers got outside the homes last night at 8 o'clock, you can hear them throughout the city. And now that Prime Minister is going to be relying on that, a lot of private hospitals becoming part of that national response as well. Who knows? I think it's another area that could potentially change.
Yeah.
But I do think it made for very different responses in the past. If you have something pre 1948, of course, you're talking about voluntary hospitals. You also talk about workhouse infirmaries and private medical care in the UK. And now you've got a very different response and better communication and coordination. So
Yeah. Public health. I hate it. I hate that term, social public health, because that's what those right
yeah.
wing.
Yes,
It
well,
is bad. Yeah.
exactly. They'll
Yeah. Public health.
misunderstand that word
Yeah.
as well. The language is so important, Joe. But
Yes.
yeah, public health is something that I think the public doesn't quite understand either.
Yeah.
But maybe something like this will teach everybody a little bit more about what public health is all about.
Yes. Absolutely. Well, it's been absolutely fantastic chatting with you and catching up with you.
Yeah,
Um,
absolutely.
I
Thanks
guess
for
you're
telling
off
me
to.
how things were unfolding in Vancouver. I had no idea about some of the things you told me about. Fascinating.
Yes. Yeah. Well, yeah. In actual fact, someone who was COVID positive, not a patient, came to my office and, self-isolated and everything. And we're all fine. But it's like, whoa, we came quite close,
Mm,
and it touches home. And
yeah.
yeah, and yeah, it's quite unique, and to share the experiences in the UK as well. But yeah, there's politics creeps in quick.
Yeah. I'm not surprised.
Yeah, yeah.
Well, it's good talking to you, and I hope some of those lessons resonate. I'm sure there's more, but those are the ones that strike me. And it's nice that we've already talked far longer than I expected. So that means it's definitely been a good conversation, both sides.